I'm Peter. I'm a financial advisor here in Calgary. I wanted to be proactive with my heart condition. I've survived prostate cancer, and when I did my follow-up interview with my surgeon, he said the #1 cause of death in people who've had prostate cancer is heart disease. And part of the reason I was successful with the prostate cancer is because I caught it early. So I wasn't going to hesitate. I wasn't going to wait for there to be an issue. I wanted to come and find out the status of my heart condition. To not do it might be selfish. To not look after my own health might be selfish. There are people that love me, the people that I love, so I should be here for them. I should do the best to make sure that I am. Accidents happen, people will pass away eventually, but why not be less a burden and live as long as possible and love as long as possible. I guess my dad always taught me, Diamond, 1 ounce of prevention is better than tons of cure. Yeah. And that's the way I've been brought up, and that's the way I see it. Why not see what's happening, educate myself on what makes a difference, learn what supplements help, learn what exercises help, learn what foods help. When I came in here, Diamond, I thought arteries were pipes. Now I know they're muscles. Now I know how inflammation actually happens. I've learned so much from here. And so to be exposed to another test, when you told me this new test was available, yes, I wanted to try it. And I have very high confidence that whatever the results tell me, I can go from there and I have a better chance of survival. I've got a grandchild now, so there's lots to live for, Diamond. Think like a large knee brace, but it's on your hips and on your calves. Going with your heart rate and counted to your heart rate. I don't know all the details, and I don't even need to know. I just trust it's gonna work. Anyways, for about 1 hour at a time, these sessions happen, and then over time, it promotes growth of more arteries in your heart. Oh, it uses a better technology. So it's just far more advanced. It gives me far more details. Even the blood work I think that was done initially gave me much more information as to, I guess, what went into my heart being in good shape or not. So I've learned a ton from this clinic for sure. Why wouldn't I want to have more blood vessels developed or more arteries developed? That just made too much sense. So I could survive a heart attack. I feel more confident that I could survive heart disease right now than before. And so this is 100% prevention for me. Nothing's happened. I'm not gonna touch wood, but I don't want anything to happen, but it just makes too much sense. This is much less invasive or potential far fewer side effects. I mean, I laid on the bed for 7 minutes and 30 seconds, we were done. I just had to keep still. So far less risk involved, far less time involved, and it's all right here. And I think probably gonna give me more data than I would through the hospitals. I'm certainly glad I got to do this. One of the things that made me further believe in this was the passion of the people that were here. And everyone that's put me on the machine, very friendly, very easy to talk to, and definitely believes in what they're doing. So I definitely have a lot of confidence in it, and I definitely find it very welcoming here for sure. Yeah, my personal experience with the